Welcome to today's Explainer. Today we're demystifying a profession that touches pretty much all of our lives, but honestly, it stays largely hidden behind hospital doors. We trust obstetrician-gynecologists, our OBGYNs, with literally our most vulnerable moments, bringing new life into the world, performing incredibly complex, life-saving surgeries. It's huge. But have you ever stopped to wonder what it actually takes to earn that title? Well, today we're looking directly at document 0511. This is the official specialty training curriculum standard for OBGYNs. And we're going to uncover the intense, rigorous, and frankly just awe-inspiring roadmap these doctors absolutely have to conquer.
Okay, let's dive right into this. Our agenda today perfectly mirrors the highly structured, multidisciplinary pillars of mastery a doctor has to conquer. We'll look at the 4-year OBGYN journey, welcoming life through obstetrics training, protecting women in gynecology and oncology, solving infertility, crossover challenges, and finally, strict gatekeeping.
So, starting off with part 1, the 4-year OB/GYN journey.
Now, this foundational timeline isn't just about, putting in time or punching a clock. It is a meticulously crafted ladder of increasing clinical responsibility and, frankly, pressure. Year 1, it throws them right into the deep end with general obstetrics and high-risk pregnancy. Then, by year 2, the focus shifts heavily over to general gynecology, which is where those crucial surgical skills really start to take center stage. Moving into year 3, the scope broadens even more to include some highly demanding subspecialties. And finally, year 4 culminates in the chief resident year. This is where they integrate the whole shebang, managing teams and really preparing to step out as fully independent specialists who are capable of handling literally whatever walks through those clinic doors.
Moving right along to part 2, welcoming life, obstetrics training.
When most of us think of an OBGYN, we immediately picture the delivery room, right? But the 05114 document reveals that the clinical volume required before they even get to that point is just staggering. 500. Before a resident is even certified, they must conduct a minimum of 500 prenatal visits. Just think about that. That means hundreds and hundreds of hours monitoring fetal development, managing maternal health, and catching any potential high-risk complications way, way before the actual due date even arrives.
And then there's this baseline requirement, 200. That is the minimum number of natural births they must personally deliver. Think about the physical stamina and the emotional resilience you need to guide 200 different mothers through labor. And remember, that is just the baseline requirement to pass.
Now, what's really interesting here is what happens when things don't go perfectly. The 0514 curriculum explicitly dictates that standard natural births simply aren't enough. Residents are required to perform at least 30 cesarean sections. And on top of that, they have to handle at least 30 complex dystocia cases. If you're not familiar, these are difficult, obstructed labors that might require things like vacuum extraction, forceps, or managing a vaginal birth after a previous C-section. Basically, they are trained extensively for those exact terrifying moments when every single second counts.
Which brings us to part 3, protecting women, gynecology, and oncology. Because delivering babies is really only half the job. It helps to demystify this for a second. While obstetrics focuses entirely on pregnancy, high-risk gestations, and childbirth, gynecology is a completely different beast. It is the surgical and medical focus on reproductive system diseases, pelvic pain, and life-threatening tumors. So they are effectively mastering 2 distinct medical disciplines at the exact same time. And as we all know, diseases definitely don't keep office hours. The baseline requirements mandate that residents handle at least 120 ER shifts specifically for gynecological emergencies. You just have to imagine the sheer lack of sleep these residents endure, probably fueled by terrible hospital coffee at 3 a.m., managing things like ruptured ectopic pregnancies or severe hemorrhaging, all to protect their patients.
So the crucial point here is that they don't just observe from the back of the room, they actually have to take the scalpel. The quotas demand participation in over 120 general gynecological surgeries, and they must personally perform at least 40 of them. For highly complex oncology surgeries, treating cancers, which is incredibly delicate, they must participate in 40 and personally scrub in to perform 10. Add to that 200 gynecological ultrasounds and 30 colposcopies for cervical cancer screening, and you really start to see the immense surgical mastery being built up over these years.
Let's transition to part 4, solving infertility, reproduction, and endo. For a lot of modern doctors, solving infertility is just a vital part of their practice. And the curriculum requires a very precise breakdown to master this.
They have to handle 100 specialized outpatient cases and manage at least 20 IUI or IVF cycles. That means guiding patients through the incredibly delicate emotional process of artificial insemination or in vitro fertilization. They also have to interpret 20 HST scans, which are used to look at fallopian tube blockages, perform 20 hysteroscopies, and conduct 50 follicle ultrasounds. It's honestly a masterclass in microscopic precision and hormonal science.
Moving over to part 5, crossover challenges, utero and breast.
And this brilliantly illustrates that women's health doesn't exist in a vacuum. It requires incredible medical versatility. And OBGYN's training actually crosses over into urology, requiring them to interpret 40 urodynamic tests and perform 20 pelvic floor reconstruction or incontinence surgeries. But it doesn't stop at the pelvis either. They are right there on the front lines of early cancer detection. They are required to perform 100 breast palpations, interpret 60 breast images, and even perform 20 breast biopsies. They are truly trained to see and treat the whole patient.
Which leads us to our final section, Part 6, Strict Gatekeeping, a Specialist is Born. So we've seen the massive numbers, right? The hundreds of births, the dozens of surgeries, the exhausting late-night ER shifts. But how is this all actually verified? Well, the curriculum dictates a strict 3-method evaluation standard. You definitely don't just get a pass for showing up. The grading is rigorous, it's multifaceted, and it's absolutely designed to ensure no one slips through the cracks before they are handed a license to practice independently.
Let's look at how this builds an absolute fail-safe system. Every single one of those 500 prenatal visits, every one of those 40 personally performed surgeries must be documented in strict logbooks and surgical diaries. They even carry these learning passports that require direct sign-offs from attending physicians. Furthermore, there are continuous hospital assessments and in-person site visits where evaluators will literally sit down, interview the residents, and audit their medical records and case logs. The accountability here is just absolute.
We've unpacked an incredible journey today through the 05-11-4 curriculum, from high-risk delivery rooms to complex oncology surgeries, all the way to precise fertility treatments. When you look at the thousands of hours, the hundreds of mandatory cases, and the unrelenting evaluations required to actually earn the title of an OBGYN specialist, I really want to leave you with this thought. Knowing all of this, how does it change the way you view your next doctor's visit? For me, it certainly gives a profound new level of respect and empathy for the medical professionals dedicating their entire lives to protecting ours. Thanks so much for joining me for this explainer, and as always, keep asking the big questions.